Hello everyone, myself Travan Soni from Dr. Harisingh Gaur, Central University, Sagar. My presentation is based on topic Outerlony double immunodiffusion. First of all, I can give introduction about immunodiffusion technique. What are the types of immunodiffusion technique? Theory, procedure, principle, applications, and at last, examples where we can use it. So let's begin. Introduction. Immunodiffusion technique is basically used for studying reaction between antigen and antibody. It also used for observing precipitate formed by the combination of specific antigen and antibody that have been diffused in a gel. This technique is based on reagents. Types of immunodiffusion. There are two types of immunodiffusion technique. First is single radial immunodiffusion. Second is double immunodiffusion, also known as Outerlony double immunodiffusion. In this slide, two images are shown which clarify the difference between single radial immunodiffusion and double immunodiffusion. Theory. Double immunodiffusion technique is the most simplest and extensively used to check antisera for the presence of antibodies for a particular antigen. Precipitate occurs with most antigen because the antigen is multivalent. It means many interpretations of values are there. Diffusion of antigen and antibody takes place independently through agar gel in two dimensions horizontally and vertically. Antibody and antigen form lattice structures that will develop into visible precipitate. Some visible patterns of antigen and antibodies are shown in images. Some factors which show that formation of antibody and antigen is based on lattice structures. Antibody must be bivalent, antigen must be bivalent or polyvalent. The pattern, which is shown in figure A, is serological identical or common epitope. The pattern shown in the figure B is crossed lines, which is non-identical or common epitope. In the last pattern C, fusion of two lines with spur is partial identical. In the slide, the antigen and antibody diffuse independently through a semi-solid medium, as clearly seen in diffusion plate image. Antibody is multispecific, which is placed in central well, as shown in the picture A, B and C. The antibody is always placed centrally. Different antigens are placed in surrounding. As so in the structure 2, case A, the two antigens are identical and antibodies are specific for antigen 1. After some time, precipitation lines form and an arc-shaped bands appear. This is because the antigens are identical and antibodies cannot distinguish between them. So the line will overlap each other, the antigen concentration will increase. The relative increase in antigen concentration result in arc-shaped precipitation formed. In case B, antigens are not identical with each other. It means they have no common epitope. Here, we add two types of antibody, each specific to the antigen A and antigen B. The cross line will form. This is because the antibodies cross each other and they are not diffused, hence cross lines are formed. In case C, partial identical means These antigens share one or more common epitopes. A common epitope is taken in antigen. Each antigen and antibody is specific to each other, and formation of an arc with spur. Procedure: some materials are required on it, such as chemicals, agarose gel, buffer, antiserum, test antigens. Equipment are also essential for it: incubator, micropipette, weighing balance, and serine. Serine is carefully used to fill the antigen and antibody in the wells as shown in image. Wells are cut in the gel, reactants are added in the well, incubate it for 12 to 48 hours in a moist chamber. Precipitate line will form. Principle: it is stated that a sample extract are placed in well on gel plate, while the antibody is placed in central well. The diffusion occurs between the antigen and antibody together, which show visible immune complexes and form precipitate lines as indicator. It is quantitative and qualitative analysis of antigen and antibody diffusion and detect antigen specific antibodies. Applications: it is useful for the analysis of antigens and antibodies, demonstration of antibodies in serodiagnosis of smallpox, identification of fungal antigens. Also used for detection, identification, and quantification of antibody and antigens, such as immunoglobulins and extractable nuclear antigens. Agar gel immunodiffusions are used as serological tests. It is used for measuring hormones, serum, proteins, drugs, and so many other things. Also used to determination of immunoglobulin levels in patient sample. Here, this is an example of pregnancy test kit, which showed that the presence of human chorionic gonadotrophic hormone present in the urine test. If the presence of specific anti-SCG occurs, then it does not form clumping, and the female sample shows positive results. If there is visible clumping or appear, then the sample shows negative results. Thanks for watching. I especially thanks to Dr. Dipali Jat ma'am, assistant professor, who gave me opportunity to represent my topic.